Ontario's Chief Medical Officer of Health gave his first update in more than a month as COVID cases spike across Ontario.
Dr. Kieran Moore recommending people continue to wear masks in indoor public settings, but there are no plans to reintroduce a mandate. Matt Ingram has more.
Holding a news conference for the first time in weeks, Dr. Kieran Moore says it's clear Ontario is in a sixth wave.
Probably 6 to 8 weeks that we'll have a rise in risk of transmission.
He downplayed his absence from the public eye, saying he's back today to raise awareness about the newly introduced fourth booster shot and once again call for masking and vaccination.
That's a message that should have been delivered every week, at least once a week, for the last 6 weeks. People have a lot of questions.
Moore says he also wanted to tell Ontarians about the expanded eligibility for COVID antiviral medication Paxlovid, something just announced this afternoon. Today's update comes as a new report from Public Health Ontario links the province's decision to lift the masking requirements in most indoor settings like retail stores or restaurants with rising numbers of COVID cases, test positivity rates, and hospitalizations. The report calls for a return to indoor mask mandates, but Dr. Moore says a mandate will only return under certain circumstances.
If a new variant of concern emerges, a threat to our healthcare system, or potentially during the winter months.
But he still wants Ontarians to wear them in all indoor public spaces.
A strong recommendation.
And so does the Premier.
I think it really comes down to common sense. We've been through this for 2 years. When you walk into a real crowded room, throw the mask on. No one's going to force you, but I would recommend it.
A new mandate isn't completely off the table, according to the health minister, who says the province would reintroduce it if recommended by Dr. Moore. In Niagara, Medical Officer of Health Dr. Mustafa Hirji says the province should bring back the mandate, and if it doesn't, he may do it for Niagara, but that approach will be less effective.
I think if we act locally and, we're a little island where this comes back, it's not going to work as well.
Moore says his team is working on a proposal to extend the mask mandate in high-risk settings, saying it makes tremendous sense. Matt Ingram, CHCH News.